Strep throat is a bacterial infection caused by the group A. Streptococcus bacteria, also known as Streptococcus pyogenes. It primarily affects the throat and tonsils, leading to inflammation and pain. Strep throat is contagious and can spread easily through respiratory droplets. Common symptoms of strep throat include a sudden severe sore throat is often the first symptom. Tonsils may be red and swollen, sometimes with white patches or streaks of pus. Fever is often higher than 101 degrees Fahrenheit or 38.3 degrees Celsius. Tender, swollen lymph nodes in the neck are also common. A headache may accompany other symptoms. Nausea or vomiting, particularly in younger children, can occur. In some cases, a scarlet fever rash may develop. Strep throat is primarily caused by group A Streptococcus, bacteria that can infect the throat and skin. It is highly contagious and spreads through coughing and sneezing, sharing food or drinks, and touching surfaces contaminated with the bacteria. Diagnosis of strep throat typically involves a medical history and physical examination. A healthcare provider will assess symptoms and perform a throat examination. A rapid antigen test is a quick test that can detect the presence of group A Streptococcus in a throat swab. A throat culture, where a throat swab is cultured in a lab to confirm the presence of bacteria, may take 24 to 48 hours. Treatment for strep throat usually involves antibiotics. Penicillin or amoxicillin are commonly prescribed antibiotics effective against strep throat. For those allergic to penicillin, alternatives like cephalexin or clindamycin may be used. Symptomatic relief can be achieved with pain relievers such as over-the-counter medications like ibuprofen or acetaminophen, which help alleviate pain and reduce fever. Throat lozenges can also soothe a sore throat. Additionally, drinking plenty of fluids is essential to stay hydrated. To reduce the risk of strep throat, good hygiene practices are crucial. This includes frequent hand washing with soap and water or using hand sanitizer when soap is not available. Avoid close contact with individuals who have strep throat or other respiratory infections, and refrain from sharing utensils, cups, or personal items. Cover coughs and sneezes with a tissue or elbow, and wash hands afterward. If diagnosed with strep throat, it's important to stay home until you've been on antibiotics for at least 24 hours to avoid spreading the infection. If left untreated, strep throat can lead to complications, including rheumatic fever, which is an inflammatory disease that can affect the heart, joints, and brain. Another potential complication is post-streptococcal glomerulonephritis, a kidney condition that can occur after a strep infection. Additionally, abscess formation, such as peritonsillar abscesses, can develop and may require drainage. Strep throat is a common bacterial infection that can cause significant discomfort, but is typically easily treated with antibiotics. Understanding its symptoms, causes, and prevention methods is essential for managing this infection and reducing the risk of complications. If strep throat is suspected, seeking medical attention is important for appropriate diagnosis and treatment.